I'll just give a little bit of additional context before we start. Senator Cassidy is, if you had to, I know you all watch the news and probably have a perspective on politics, which tends to generate what I'll call like adverse selection bias. The noisiest people are the ones talking the most. Bill is just, I think, really the model of what you would want as a responsible legislator. And you're about to see, I'm not just saying this because you're here, by the way, substantive, thoughtful, bipartisan, really well regarded universally on the Hill. And that's because he's taken nuanced, fact-based approaches to difficult problems. And I think you'll see that is the kind of person that you want developing regulation and thinking about a regulatory framework for AI. And it is, as we'll probably get into, a multifaceted situation. So I'll just say that Bill's just been a great friend and somebody I respect a ton, and I'm glad that you all will have the chance to see that in his thought process and how he approaches something conceptually like regulating a novel transformative technology.
And let me just comment. When Brian asked me to come here, he said it's kind of like a small little symposium. And I walked in, I'm thinking, Brian, I'm not sure you're exactly honest in terms of how this was supposed to play. And I'll say also as well, I just taught a course a semester ago at LSU on regulating AI. And my co-teacher said, but no one's regulated AI. And I said, of course, that's why we can teach the course. No one has done so yet. It is such a kind of the whiteboard is empty type of topic that I look forward to this conversation, but in true honesty, look forward to your questions. Because this is something that we as a society have to resolve. There are issues which will take that kind of discussion and debate. And so I don't come here as a font of answers. I come here as somebody who is searching as to how we can best do this as a society. So just to say that.
That's great. Maybe we start, you and I have talked quite a bit about the opportunity, the potential for AI in healthcare. And we talk about healthcare too. It's a $4 trillion industry. It's multi-subsectors. But maybe just to frame how you come into regulating something, maybe start with what do you see for the prospects? Where do you see the greatest potential return on investment from the application of AI, whether it's to clinical delivery or drug development or administration, even government oversight?
That topic is so wide open, you almost don't know where to begin. Now, I want to speak again as a physician who happens to be a senator, but as a senator who will be on the committee which has jurisdiction over regulation of AI. And you have to kind of break it into categories. There was an article or a study done, I think by Boston Consulting, that looked at so this is Boston Consulting, really high-powered, motivated, highly intelligent people. And they took one group and they trained them in AI, and another group and they did not. And they came up with what I at least consider 4 groups. One were the Cyclops, the Centaurs. They were half man, half AI. And the man or woman would do that which they were good at, and then they would allow AI to do the other. The other was the cyborg, in which they kind of interdigitated. And so they kind of all, you couldn't tell where AI started and the human began. And then there was the control group, which didn't use AI at all. And they found over time that the AI group outperformed this group. And then they said, okay, wait a second, let's come up with a question that AI cannot answer. And they came up with something highly nuanced in the emotional realm, highly nuanced. And they found that those who were AI independent, I will call them, looked at this, they said AI's assessment of this is incorrect because of these emotional issues. AI didn't pick it up and they made the right decision. Those who had not been trained on AI came to the same conclusion. But there's another group that grew lazy. They grew lazy from AI and they didn't pick up on the emotional tells, if you will, and they actually misdiagnosed the problem. Now, why do I go through that? AI has the clear potential, and studies have shown this, to take, if you got a bunch of radiologists and some specialize in breast cancer mammography reading and the others do not, It can make the non-specialist almost as good as the specialist. It can make the specialist a little bit better, but the rise is not as dramatic. AI clearly has a role there. We can see that. It can improve, so you have a nurse practitioner who's treating a highly complex patient in a rural area of Louisiana. AI, through a clinical guideline, will hopefully be able to guide her into making a decision almost as good as the specialist who would be here at Columbia. But you also want to make sure you don't create AI cripples in which people are just routinely doing things even if they are routinely wrong. And you see some evidence of that, where people become so dependent, it's like, why are we even here? So there's a lot in there. There is the potential, there is the negative, there is the regulatory, who bears the liability if somebody becomes a AI cripple and stops making the wise decision. Is it AI or is it the person? And is there anything you can do in terms of regulation for this? There is, but we have to think about it wisely. I mean, I'll just start there and I could keep on going to another area, but let me stop there because it shows you that whatever area you speak of, they're just like, it just explodes in terms of issues and in terms of what you have to consider.
Maybe before we get into those specific areas, it might be helpful for the audience to kind of better understand your process from a legislation development perspective. So how do you go about, your committee has jurisdiction, your ranking member, more likely than not, this isn't a partisan comment, just a statistical one, likely to be chairman of HELP next year, set the agenda. What's the process that you go through to educate yourself on, the kind of issues we're going to talk about tonight? What kind of teams do you have working on that? Just give us a little bit of a framework for how someone who's chair of a committee of jurisdiction on a big complex issue sort of builds the foundation to then develop legislation.
I can't speak to all, but this is the way we did it. The woman that is my staff director, who runs the show on the minority side, we did this. I think we invited Chairman Sanders, Bernie Sanders is my chairman, to join us, but they just weren't interested. That's not what they wanted to focus on. And so we sent out an RFI nationwide. One of you may have replied to it. We get that back both in the health, education, labor. Pension's not a big thing as far as I can understand when it comes to pension, when it comes to AI. And then we reviewed that. Some of them we may call back. So at least in the labor space, I called these folks and said, and had a dialogue. Simultaneously, when I teach a class at LSU every semester, and so that semester I chose to teach about the regulation of AI, as I mentioned. My co-teacher, which I didn't understand, but some of you will understand, he's a philosopher. And I thought, oh, that's interesting, the philosopher's doing AI. It turns out it's all about philosophy. And so we lost half the class because he kept on recommending 80-page long articles to read. And for some reason, ChatGPT wouldn't summarize them for some of the students. But I learned a lot from that. And then as I mentioned, we had like a guy from MIT come and Meta came. So it's a process of trying to see what really smart people think and review both what they say in the RFI but also in their papers, as well as my co-teacher, and try and collate it into not a set of this is how we're going to do it, but a framework by which to approach. Because the framework will continue to get built out.
Right. And
you will participate. I'm being very serious. What I learned from you in the questions will be part of that building out. Next Congress, we will, if I'm chair, we'll have a series of hearings in which we attempt to have people like you come speak, and at some point, pen to paper, we'll begin to write regulation.
The history of regulation generally starts with some kind of demonstrable, whether that's real or perceived, problem, some societal harm, some issue, and then there's a set of corrective actions that are taken to address that. AI is somewhat unique in that the technology, maybe not for recreational use, but for business use, is still evolving. And one of the challenges we have in our companies is introducing something like AI is not like introducing other types of functional software. And so the process around that, I think we're still in this cycle where there's a lot of prognosticating about what AI will do, but it's not doing a lot yet. How do you think about sort of prospectively regulating?
So the way I think about prospectively regulating, and one of the, I'm going to give you 2 or 3 things, then I'll connect them at the end. First, I think there's a lot of damage being done to people's privacy now that people don't realize, and if they knew about it, they would be very upset. So let me just say that. Put that to the side. We, as a response to our RFI, somebody from Stanford responded, and very, not really long, but really good. And they suggested the paradigm of, okay, you have a policy, a process, and a result, which is low, medium, or high risk. And the same policy process can end up being low or high risk. So if you use facial recognition to organize the pictures of your grandson on your phone, as I would do, that's low risk. But if you use facial recognition to identify people that you are going to discriminate against, that would be high risk. So the same process. So one, I think that the regulation should focus on that which is high risk. Secondly, there's a lot of things which current law already covers. So HIPAA covers medical records. I don't think we have to regulate that. Okay, so we don't have to regulate that. So if it's low risk or medium risk, take that off the table. If it is a business process which doesn't involve, any potential for discrimination or something untoward, that's off the table. That's low risk. In a sense, you have to define those values that you're concerned about as to being high risk. And if it's already covered by a law, you take that off the table. What I'm trying to do in my own mind is get the universe of what we have to consider with regulation not as small as possible, but as small as it needs to be, because you want that incredible innovation to occur, but you want to make sure that it doesn't deny people agency. And I think that each of us, the regulation should be there to preserve the individual's agency.
That makes a lot of sense. Let's go to privacy. I know that's something that, even separate from AI, you've released some white papers, and there's been innovation around devices, wearables, we talked a little bit about, even outside of AI enablement. Where do you see the current gaps on privacy regulation? I'm not sure if everybody's familiar with HIPAA, but it's the Health Information Portability and Accountability, and there's another A in there, Authority or something Act, which governs the use of your personal health information. Who can have access to it? There's some affirmative things on your being able to share it or access it if you want to. Theoretically, there's portability, although that's harder in practice than conceptually. But clearly, like, the methods of collecting personal health information and the manner of collecting it has outstripped the original set of guidelines from your perspective. Maybe can you talk a little bit about that and how that feeds into your perspective on AI?
I once spoke to a headhunter, and he said that he could glean from, okay, so let's imagine Brian Regan is applying for a job, and the people to whom he is applying want to know more about Brian, and he can go through publicly available records, including your searches, and find out everything about you. Oh, so he is searching for IVF. Ah, well, his wife they may want, that's an expensive thing. Do we really want him on our insurance plan? Now, this is publicly available. He's looking for HIV. Is he HIV? Those drugs are a lot of money. We see from 20, now this is a little bit of a stretch because theoretically there's a law from it, but this is my own bugaboo. Somebody, if I asked you to raise your hand if you've had 23andMe, you would raise your hand. Well, that data is sold. So 23andMe has sold their database of genetic material to people, which just bugs the hell out of me. And there's a 26-page form that you sign, and somewhere down there it says it can be sold. But most people are more concerned about learning if they're part Lithuanian than they are about what the fine print says on a 26-page form. And if they sell that data, which they have, that's the ultimate in the sacrifice of my privacy. Now, insurance companies are not supposed to use that, but I still think it is a method by which we barter away for a pittance the most private details of our lives, not sure how others are going to use it. I'll give one more example. I'm going to demonstrate this one. and I was speaking to some earlier. Johnny Isaacson was a senator from Georgia who had Parkinson's. So we're on the same committee, and I'm sitting at the dais, and I'm reading on my phone or something about how an insurance company had offered to give free Apple Watches to whoever signed up for their plan. Now I'm going to show this. And then I looked down and I saw Johnny. Now there is a very characteristic stutter step of people with Parkinson's. They go like this. An Apple Watch would pick that up. Now that is not HIPAA protected. You can sell that data from that watch. Now, I'm not talking AI. I'm just talking like what's available now. But imagine the power of AI to scrape the internet on Brian Regan, to look at his social watch, to say, to look at what he buys in a grocery store, to look to see if he's a smoker and how much alcohol he buys. And then AI just collates that.
That last one would be bad.
We're two Irish guys. That's just the way it breaks. But you could collate that. I think the implications for our personal privacy are tremendous. By the way, well, I'll stop there because I think that's bad enough. That was somewhat of the motivation behind what California did on social media.
Yep.
Okay, now we're just talking social media. But you stick AI in there and it has incredible potential to, I think, to work for mischief.
So when you think tactically about how you advance AI regulation in a divided Congress, a Congress that maybe doesn't always appreciate sort of nuance and substantive policy, speaking, globally.
So
do you come after something like privacy separate than AI, or is your intention to try to, have a broader umbrella that includes some of the things you described, have AI relationships and could be a toehold, some do not? How do you think about advancing policy?
We have not put pen to paper yet, but we did a separate AI and a separate privacy paper. But you can imagine there being some overlap.
Yep.
Now, tactically, Chuck Schumer, obviously a Democrat, had a bipartisan group of senators in order to come together on a bipartisan basis. And right now, there's no fault lines out there. I don't know what the House has done on this, but Schumer ran a pretty open process, and you'd have, like 15 people or 20 people come, and there might be Randy Weingartner from the teachers union, and there'd be Mark Andreessen from AZ 26, or Eric Schmidt, or someone like that. So they attempted to put some stuff together. Now, HELP, I think, will be separate of that process. By and large, I think. One, I feel a little jurisdictional on this. But for example, FDA has been doing regulation of AI for some time. And FDA, a lot of people complain about it, but by and large, people think FDA has done a good job with AI regulation in the case of medical devices, for example.
Right.
So I think that ours is separate enough that we can come up with our own regulatory regime. Now period, new paragraph. Next. If I have a serious piece of legislation I'm working on, for example, the surprise medical billing, my first statement to my team is, who's our Democrat? Okay, that's a good Democrat, meaning that she will work with us, she'll keep things in private, she'll be honest, we'll be honest, she won't be offended, I won't be offended, and we can build out. And then you find out, okay, who's my Republican and my Democrat on the House side? That's a little bit more shirts and skins because it's strictly who's a majority, whereas in the Senate you have to have 60 votes. But we start off trying to find a partner with whom to work, and that just makes sure that you don't get stopped on something stupid. Chris Murphy and I once worked on mental health, and he goes, Bill, I know what you're trying to do, but people on my side are not going to like that language. Can we change the language? And so, yeah, we can change the language. And Chris, I can tell you we're going to lose all my votes on this side if we go here. Okay, we won't go there. So it gives you a little bit of a balance going in so that whenever you start to actually socialize it, you're prepared for what might happen.
Let's pick up on the thread on devices. The FDA has, well, it might probably higher now, but end of last year at about 700 AI-enabled devices, where the traditional term of device generally has a physical aspect to it. There's software too that falls in that category, but there's a physical aspect to it. how do you think about some of these new, let's say, clinical decision support tools, clinician supplemental tools, algorithms that are used? They don't necessarily fall under the device category. FDA now has experience regulating AI-enabled devices, but not necessarily standalone AI that has a clinical application.
I'm not sure FDA has jurisdiction, has the right to regulate a clinical decision pathway. And that's very process-oriented, but let me just say that. And there's a specific piece of legislation that placed it someplace else. But let's just leave that to the side. I think it also, though, brings up a more interesting issue when you think about AI. How do you know that AI is right? Is it hallucinating in terms of how you imagine treating this particular heart failure patient? And the consequences would be tremendous. Now, the way that they've done, and I think this is wise, the way they've regulated AI-enabled reading of chest x-rays is they will approve an iteration. They will allow the company to continue to collect data over the year, but they can't upgrade the software or the algorithms, if you will, until they review that accumulated year of data. So it's not like the whole year you're moving off in a different direction. It's like, no, you have it set in stone, but you're collecting all this information, and then they review it to make sure that the collection of the data has not biased the algorithm one way or the other. Right. I actually think that's a pretty wise way to do it. And chest x-rays is a fairly straightforward thing, but you could imagine something else that oh boy, my gosh, there was some explanation that we didn't pick up along the way. Right. So I think they've done a good job there. My own thoughts, for example, let's take a very complicated patient, heart failure, HIV, and renal failure. If somebody's got an algorithm how to manage that, I would have the best doctors in those fields come up with the way they would manage that particular patient, compare it to what AI prescribes. If there's a difference, go back and see why there's a difference. And if the docs are right, correct the algorithm, and if the algorithm is right, correct the docs. But you'd always have something in process in your practice guidelines to make sure that it was being checked against the very best that was out there. But I think we have not yet regulated that. I just think that would be a wise way to do it.
Do you think that's an area that requires regulation if ultimately the clinician still holds the decision-making authority and there is an existing malpractice system, there's peer review, there are all kinds of structures, some of them legal, some of them more process-oriented around that? I'd be curious how you think about the culpability, if we're talking about exception cases, of the algorithm versus the clinician.
I think, well, first the question is, do you need a human in the loop? Now, if the only reason you have a human in the loop is to absorb liability, as a doctor, I think that's a pretty poor reason to require a human in the loop. And arguably, if you've got this blue ribbon panel of specialists agreeing that this is the way to manage certain complicated patients, and you've got a journalist practicing in a rural area who otherwise would not have access to this panel of experts, I guess you have a human in the loop, but you've got to think through the liability, because the bias is going to be always to believe the program and not to believe the physician. If the only reason to have the human there is to absorb liability, every doctor and nurse is going to bow out of that situation. Right. And there was an article in the Wall Street Journal about AI in a hospital. The nurses were told basically go with the AI. There's an experienced nurse that disagreed with the AI, and I forget if she countermanded it or what, but let's say in the theoretical she countermanded it, or if she didn't and something bad happened. So do you blame the nurse? Or do you blame the hospital administrator who sent the signal that you should not countermand AI? So for the lawyers out there, I mean, this is what we've got to work through. The liability issue is huge. Because, of course, the AI companies don't want liability. Right. But I don't think it's fair to the humans in the loop that all liability be preserved for them.
Yeah, it's fascinating. Maybe pivoting a little bit to the administrative side of healthcare, depending on the studies, I think your paper actually referenced this, somewhere between 15 and 30% is spent on administrative support for healthcare. And healthcare, as anyone who's experienced it personally knows, is quite complicated. There's multiple constituents in most transactions, there's a lot of friction due to the complexity. Where do you see the greatest opportunity maybe on the administrative side? And at what point, though, because somebody's friction cost is somebody else's job. And as we think about the implications of AI for society, you can remove friction from healthcare and people will pay less in healthcare. You could eliminate coding, let's say. That's great for everybody except coders. And I think you could replicate that same example across the economy. So as you think about the development of AI and its potential to reduce friction in healthcare, to what degree do you feel like it's incumbent on your committee to figure out, what is the displacement challenge here? Low sociability, repetitive task jobs are the ones that are most vulnerable to disruption from AI, and that describes most of that 15 to 30% of what other people call friction costs or administrative drag in healthcare. So how do you think about balancing those kind of societal priorities? Lower healthcare costs, but it's a significant employer.
I am a techno-optimist. And let me back up a little bit. I once read, there's a guy named George Gilder who, a techno-optimist, but he points out, and I think it was George, that when they came up with automated switchboards, they thought it would put all these women out of work. But instead, the women went on to very much more productive jobs, including being CEOs. So that menial job became dead, and praise God, it became dead. So let me say that. Secondly, healthcare costs are a major drag on productivity, a major drag on the economy. One of the reasons, just really quickly, one of the reasons why healthcare costs remain so stubbornly high is it's very people intensive. It is very difficult now to replace the humans involved, but that's typically how you lower costs while preserving quality and improving. This gives us a chance to lower costs by lowering so I think actually there'll be kind of increased productivity for non-healthcare companies, because theoretically we could begin to actually shrink that 17% of GDP down to a little bit less. Thirdly, just a positive example of where I think it's just, there's a small price to pay. When I was treating patients, we had paper notes, and if someone had cancer, I was focused on them, I was looking them in the eyes, and people hear cancer and they think I'm going to die. And your challenge as an empathetic physician is to communicate, you have cancer and there is hope. We've got a plan. Now I can promise you, if instead you're typing on the dashboard, you've got cancer, you've got hope, that is much less. You just lose that entirety of seeing, wait, they are not hearing what I'm saying. Or they understand it, but they have questions. That is what you get in that human interaction. So now they have scribes who sit there. But having a scribe in the room pecking still denies intimacy. I can just tell you. For example, have you ever cheated on your wife? Young 18-year-old over there typing away. You cheated on the wife, yes. Now, you may think that record is personal, but I can promise you the answer is going to come out a little different, potentially. And those are the kind of conversations physicians routinely have. With AI, it can be in the background, transcribing the conversation. As I say, you have cancer, but you have hope. It is contextualizing that. And according to the advocates for this particular program, it is contextualizing that. And so it actually will record a note, but the patient had questions. The questions were answered. There still seemed to be doubt. Now that's the promise. So there we're losing an employee. Praise God we lost that employee. We're glad we lost that employee because it denied something very vital in the relationship. So I'm not sure that losing the employees are necessarily bad. And lastly, because I do think that I'm a techno-optimist, because I do think there's going to be so many more opportunities. In my state, unemployment is very low. If you have somebody who's going to pass a drug test, who's going to show up every day, who's going to come in and she's ready to work, she's going to have a job. So if you're speaking about the folks who are a little bit lower in the pay scale, I think there'll be opportunity for them.
Yep, makes sense. What do you think about on the government side? We obviously have a very large healthcare bureaucracy. And I don't mean that in a pejorative sense. It's just literally we have thousands of people at CMS and FDA and CDC and NIH. How do you think about, one, collaborating with them on the development of this, and two, the application of AI, because a lot of what we just talked about in terms of routine tasks and transaction processing and things like that, the government necessarily has to do that. So how do you think about the use by the government, not just about business, of AI?
If anybody's been watching me right now, they can see that I've suddenly tensed.
Sorry.
We had a VA committee hearing last week, Veterans Administration, and they're trying to implement something called the PACT Act. And I forget how many billions, but the VA has established halfway through the fiscal year that they're like $3 billion short in their budget. You're $3 billion short, like what happened there? And it turns out they've hired an additional 10,000 people to process these claims. But they're way behind in processing the claims. And they've hired, did I say they've hired 10,000 people? I said, well, how many times a week do you come in? I mean, you got to work from home, you come in, we come in 2 days every work period. How long is a work period? Well, it's 2 weeks. So your people come in 2 days a week, and you count on them working at home. Yeah, that's the rule. Have you thought about using AI? Well, IBM has a contract. Well, what are they doing? Well, right now they're using OCR. I'm saying they're using optical character resolution. They're taking paper, IBM is taking paper documents to put it up, and that's your version of using AI? I was using OCR 25 years ago. I said, well, why aren't you using AI? And said, well, our employees fear that it'll put them out of work. I mean, I wanted to throw a chair. I'm like, this should be about the veteran. This should be about the veteran who's behind getting his or her benefits. And yet you're telling me that you're not going to process it faster because you're worried about these 10,000 people extra who only come in 2 days a week, which may be unfair. Maybe they're monitoring at home. I don't know that. And God dog it, you're more concerned about, you just want to explode. Now that was something perfect for AI. My co-teacher, Roy Heidelberg, he describes AI as the ultimate bureaucrat. It can take all the information and it can make the most impartial decision. That is the ultimate bureaucrat. And this is something which can take all this information, and sure, you would sample every now and then, some would fall out, but it could just automate that and take care of this problem. And instead, we're not doing it. That is a promise which is denying taxpayers value for the dollar. It's denying veteran a ready resolution of their issue. So I am really urinated off about that. I am just so urinated off. And that is something which, we should be able to do better at.
Okay, that was the third rail there.
Third rail for me, man.
What do you think about, there have been a number of consortia. There's Train, which is like trustworthy, reliable AI network, which is a syndicate of health systems working with Microsoft. The National Academy of Medicine has put out a set of principles about AI. How do you think about the interaction between kind of market left to its own devices, doing what it's doing, some of these groups that have come together to try to sponsor a set of sort of self-governing actions, and then regulation that gets, I want to say imposed again, I don't mean in a pejorative way, but just regulation that gets passed by the government. And how does that have an effect on where you think about drawing the lines?
So there's a lot in there. So the insurgents feel like the incumbents want to put in regulations which limit the ability of the insurgent to challenge the incumbent. I've had that conversation. Now, the incumbents feel like the insurgents will cross any line in order to.
Right.
So I know what I've been told, but not what I know. And I am quite all right if there is a third party that comes up with a, wise sort of way to manage this. I'm quite all right with that. But I'm not naive enough to say, oh, let's just leave it to Microsoft and everything will be okay.
Right.
Maybe, but maybe not. And by the way, Meta disagrees with Microsoft
right.
in terms of regulation of AI. And so even among the really big incumbents, there is a disparity of thought. So I think ultimately the Congress will have a responsibility. And by the way, I don't know, did Gordon Wood teach here? Gordon Wood's a great historian. But at some point, I heard him speak, he said, Congress must step back up and take responsibility for creative solutions. I personally think Congress should do that. And this is a point where we need creative solutions. Heavily dependent upon the private sector, but being somewhat of the referee between those different stakeholders, achieving the goals and the promise, but while respecting and preserving the agency of the individual.
I think we have reached the end, thank you, Senator, of not the end, the fireside end. And so we're going to turn it over to Q&A.
All right. So if you haven't had a chance to put in a question, feel free to do so. We talked about this a little bit earlier, but for the broader audience, we'd love to hear your thoughts, Senator Cassidy, in terms of how regulation in the U.S. around AI compares to other governments, particularly the EU, where they have the EU Artificial Intelligence Act, GDPR. And so curious your thoughts as to why the U.S. has taken maybe less regulation thus far and where you see things going relative to peer countries.
So the EU, according to stakeholders, has so tightly regulated the development of AI that the best AI companies will leave. Now, I've been told that if you just take, and I may be a little rusty on this because this was told to me about a month ago, but if you take the top 5 companies in the U.S., in our stock market, that the market cap of those 5 is greater than the market cap of the entire stock market of maybe everybody but China. And maybe if you put them together, they're still bigger.
Yep.
And so you can certainly say that when companies seek to develop, they typically seek to develop in a lower regulatory state, which is the United States, and we benefit from the economics of that. One more thing, I was just told that France's per capita GDP is like, the guy just sent this to me, but it's like 10th from the bottom. They're only better than 10 states in the United States in their per capita GDP.
Yeah, England is too.
Yeah,
Britain.
It's just amazing. So one, we have to
Pretty stunning.
recognize that our regulatory environment in other areas has led to dynamism being in the United States, and we wish to preserve that. And I do think that the United States should have a little bit of a lighter touch. When I reviewed what the EU did, it really is highly prescriptive. Now you can put that here and look at the Chinese. The Chinese, you're not going to mention Tiananmen Square, and over there. If you do, you're going to get busted. You have to promote social harmony. They don't define that, but they leave it up to the developer to understand that they have liability in case something challenges social harmony, and you can imagine the chilling effect that has upon AI development there. That may work well for engineering and for medicine, but maybe not so much for other things in the large language model. So I think the U.S. needs to have one which is a little bit more focused upon the high risk, not upon those other things, and to look at where we already have regulations. I'm repeating what I said earlier, but try and narrow the universe so that we are only predictably regulating things in that smaller, I hate to say a universe is smaller, in that smaller subset of activities, and we allow almost any development to go on over here. Now, there's still other issues. If somebody is using AI to make nude photos of the high school senior that he goes to class with, there has to be some discussion of that liability, okay? But that would be a high-risk activity of image making.
Right.
So I'm not saying this is easy, but I think you make the point.
Yep.
Maybe building on that a little bit, this balance between innovation and protecting the citizens. And so as you're trying to ensure that the U.S. kind of stays ahead of the market, continues their innovation, how do you ensure in those high-risk settings, what are the guardrails that need to be put in place, and how do you see your role in setting that up?
So you have to, and again, someone in here is going to have the answer on this. What can you do to set up for privacy, for example? You can make a digital twin so that you ensure anonymity, or otherwise seek to have, you could have a data pool where everybody's data is dumped in and somehow you can't associate it back with the person from whom that comes. Or you can have AI in a federated system in which a friend of mine at Boston Children's does this. They've got a federated system which Columbia may be part of. And they can dip in and they can look at people's data in the maybe Boston Children's database, and then maybe down here at Dallas Children's, or someplace in New Orleans. And then it comes back up, but the data is never pulled up, it just simultaneously analyzes. So I think we need to think carefully how we allow AI to access data, but to preserve anonymity. Now, you can still argue that something of value is being taken. I actually think about this a lot. Let's imagine 23andMe sells that data set, and someone in there has genes, has a genetic makeup, which is worth $1 gazillion. Yes, you signed a consent, but it was 26 pages long. Should that person share in the proceeds from this? Now, they say on Broadway, you can make a killing, but you can't make a living. I don't want our society to come where people are using all of this privacy data and they're making a killing, think Silicon Valley, but those people who are donating the data, us, by the way, us, get nothing from it. Yeah, I get to work on Google Docs, and I get to find out if I'm part Lithuanian, but I'm not really enjoying the fruits of the fact that my genetic profile either had the cure for some terrible disease, or it was used as a control to compare the guy with the cure or the gal with the cure to me who does not have the cure. I think there should be some value in that. So how can you make it so if AI is using our data, we actually partake of the proceeds? I'm a little far afield, but I feel like our society needs to do something to more evenly distribute relative to the contribution we make to some of these advantages that we're going to enjoy in the future enabled by AI.
On the flip side to that, an AI model is only as good as the data that is fed into it. And so I think you hear about all of these data leaks, cyber attacks, and so people are rightfully skittish about their data being out there. And so I'm curious how regulators could help facilitate that sharing of data while also ensuring the protection of the citizens, and both from it being used in the ways that you're describing, but also in these types of cyber attacks where people's data have been being held hostage to, bad players.
Hey, I don't have an answer on that, and if someone does, please come up and talk to me afterwards. It's a huge issue. I had coffee with somebody earlier who's got a company that does this, but it's always after the fact when the cyber attack has been discovered. I just mentioned those things earlier about the data pools, about the federated system, et cetera, but I certainly don't have a good answer for that.
Yeah, and I'll just add on, we have 30-ish companies, and they are constantly under cyber attack. And we spend a ton of money. We're now hiring at our firm a cybersecurity expert. I think everybody here should be eyes wide open about the integrity and privacy of their data generally, because no matter how robust your defense is, how much time and effort you spend trying to adapt them, the capability of the people on the other side, many of whom are state-sponsored, exceeds any given company. It's particularly true in healthcare, where you have independent physician practices and hospital systems that naturally have tons of users who have to get to that same sensitive information, and generally speaking, people are the vulnerability in any system. So I don't know that there's a great practical answer for that, other than it's something we think about a lot. Our companies, it's top of mind, but it's a very, very challenging environment. And my guess is we'll get more so as the hackers employ more sophisticated AI.
So here's another question about AI specifically, and you mentioned that AI can be the perfect bureaucrat because it can make impartial decisions. At the same time, AI learns from humans, and humans have their own biases, and so AI may introduce those biases back in. And so how do you grapple with biases in AI in medicine and in government? And do you think that that's something that should be regulated, or is that something that the private sector, public sector should be working towards?
This is a longer conversation. I'm going to change. We have so many biases when we come to the word bias. I'm going to not use the word bias. I'm going to use the word predilection. Okay? We have a predilection. Well, let me start over. There are some predilections that are clearly wrong. A predilection to say that according to patterns, women are not as often to be a CEO, so therefore our firm will not interview women to become a CEO. That was a wrong bias, a predilection that was in a large language model. Sometimes society prescribes predilection. We want to make sure that our high school has a certain diverse character. And so therefore we are going to prescribe predilection in terms of who we recruit to our high school. Okay? Sometimes what is called bias, and in the literature they kind of fuzz over this, but sometimes bias, predilection, is merely a recognition of reality. If you notice that most NBA players were tall, you would say that being an NBA athlete, you have to have a predilection towards height. And the large language model would say the guy or the gal who's the guy who is 5'2" is not going to be an NBA player, but the person who's 6'10" might be. That is a predilection based upon reality. Okay? But in the literature, that will be called a bias because it is pointing out that which is clearly evident. Now, then there is the predilection, which is more interesting. There's a hospital in Baton Rouge. CMS put out a guideline to detect sepsis. Sepsis is overwhelming infection. You come to the emergency room. Centers for Medicaid and Medicare Services wanted to make sure that hospitals were adequately screening for sepsis. And they put in financial penalty if you did not. So there's a hospital in Baton Rouge, Our Lady of the Lake. They went to some programmers at LSU. They came up with a foundational model to look at sepsis. But it turns out that the regulations from CMS introduced predilection. It introduced bias. So much so that you were overdiagnosing sepsis. They called it diagnostic anchoring, which I'd never heard that term before, but you hear it and you immediately know what it means. It means, okay, AI tells me that they are septic, and so I'm going to pursue a workup of sepsis, ignoring the fact that there's other evidence that they may have had a pulmonary embolus. I'm making this up, but this is as the infectious disease doctors were coming to me. Now, the wonderful thing about this and about our representative democracy, one of these doctors was one of my former students, and he calls me up and we have coffee, and so we connect him with CMS. And CMS is actually changing their reg to address this, and they think they fixed the issue. And by the way, that's how it's supposed to work. And by the way, I say, if one of you has an idea that we should talk, we should discuss. I've got a plane to catch, but still we should discuss. So you can introduce predilection or you can introduce bias by a regulation which is the penalty if you don't comply with is so onerous that you end up skewing in a direction which you wouldn't. So I think we need to, when we think about predilection, we have to define which of these is it more likely. The really bad, the introduced, the one that society actually wants you to have, or the one which is merely reflecting the reality as it is on the street. NBA basketball players tend to be tall. So going back to the bad, there has to be some sort of, if it's a high risk, here's my algorithm, it is high risk, we want to make sure that there is not a predilection against certain groups in terms of being accepted as a purchaser in a housing development. So that is high risk. And the people who write that algorithm should be able to communicate why they got the results they got. That is where you want transparency in outcome, okay? You get that. And so I would emphasize the transparency only on that high risk, and leave the other kind of predilections to the side. Okay.
Right. So I'm going to close with one last question that is a bit forward-looking. And what do you envision for the space of AI regulation in the space of healthcare 20 years down the road?
I have no clue. One of the young men who works with me has the suggestion that we really don't try and regulate AI except insofar as they did with Taft-Hartley. 100 years ago, almost to the year, Congress said we cannot imagine antitrust in 100 years. And so we are just going to give general guidelines, and we're going to rely upon the courts to develop a common law by which they address. Now, there's something to say for that, except that AI is so rapidly developing that 10 years may be equal to 100. But you can imagine saying, okay, we want only those high-risk activities which deny people agency in terms of the preservation of their privacy to be subject to regulation. And yes, we're going to write these laws, but we want the courts to understand, even if there is a use case out there which we've not imagined, the court should say that if it violates these principles, it has to be high risk, it has to be beyond a certain scale. It can't be an isolated person, as much as you just tie yourself up in the courts, and that it would have the effect of, there'd be other things, but I'll stay with this because I've developed it already, denying people agency or control over their own life without their willing consent and without what a reasonable person would consider would be a reasonable consent. I think that would be a pretty good guardrail for courts to work on. Now, then I'll tell you, it'll break down whether or not it's civil penalties or whether it's a private right of action, but that's another story that the lawyers can debate about. But they would give the guardrails for the future, but point them in a direction with what we do now.
Great. Well, thank you so much, Senator Cassidy and Brian, for being here and having such a exciting conversation for us. Thank you, everyone, for joining us
Thank you.
tonight, too.